Okay, so it's gonna be like you're looking straight at yourself. So let me get to recognizable structures here. Okay, so it's like you're looking straight at yourself. Here's your right eye. Here's your left eye.
Yeah.
Oh, by the way, I was gonna ask, any numbness over your cheek?
Yes.
Okay. How long has that been going on for?
Month and a half, maybe 2.
Okay. And any dry eye on your right side?
No, I haven't noticed dryness. One of the things when I was thinking that it was sinusitis, I was sleeping upright because sleeping horizontally was creating congestion and pressure, and that was, I was waking up feeling this fullness in my eye.
Okay. Well, so here, let's take a peek at it. So right eye, left eye.
Mm-hmm.
So the air around your head is black. The bone is bright white. Here, like the tops of your front teeth. This is where glasses would sit, like right here.
Yeah.
Bone of your forehead. Now here are your first set of sinuses, of forehead sinuses. These are normally filled with air, so they're black. And there's actually normally nothing in them, so there should just go black straight onto white. So gray is basically everything between those two densities: bone, your teeth, or air. So your eyes are gray, the skin over your teeth, your cheeks. As we work our way back here, we're going to see some more sinuses. So here's your cheek sinus on the right side. Cheek sinus on the left side.
That's right behind my cheek.
Exactly.
Yeah.
It's like a centimeter.
Yeah.
If you were to poke a hole in your cheek, you would be into a pocket. And you can see there's some gray here, right? So this is actually the lining of the sinuses, and it's a little bit inflamed, it's thickened compared to this side. As we march back further here, this is the back wall of the sinus, the left side, and you can see this looks like a little circle. So this is the mass.
Okay.
So what we look for on this is so here it is, it's getting a little bit bigger, filling up the back side of your nose, right? So it's starting to cross a couple of spaces. So what I'm looking for on this is that I'm looking for bony landmarks, because ideally this would be staying and respecting those bony boundaries. So as I march back here, to me this bone right here is this bone right here. And to me it looks like there's like it's smaller and thinner over here, like it's been eroded. And as I come back further, this bone right here would be this bone right here, and actually there's a gap in that, right? So this is your temporal lobe right here, and there's a gap right there. So
you're saying that the bone has been taken over by this mass?
That's what it looks like. It's gone. Where there should be bone, there's just mass. And
with that, we went through a period where he literally smelled like death, like something rotted inside of him. Could that have been that?
Yeah, so it could be that so your ability to smell comes from the top centimeter of your nasal cavity. So there is tissue here that is not normal, and it may have outstripped its blood supply, and it could be rotting essentially in there. You get necrotic tissue in there, that's possible. I mean, I can't tell if this, but
so I didn't know I thought that smell that she was talking about was from tooth decay, which I did have.
It could be that.
Right.
But
because that was at the beginning of it. So the way that we came upon this is coincidental from all of that.
Yeah.
Right.
Totally. So I mean, in some way it's sort of fortuitous because that started the workup,
Right.
But yes, then the other thing is that so here's your left sphenoid sinus, and it's filled up with something, and it could be that this is mass, or it could be that this is inflammation. But what I'm going to point out is that this is the floor of your left sphenoid sinus, and you should have a floor to your right sphenoid sinus. So it's broken out of that boundary. Now this goes into your nasopharynx, and so that could cause nasal obstruction. But there's just this bone again is now there's this wall is broken. This wall has been eroded. This wall has been eroded. So it's not respecting boundaries. That's the alarming thing about it. This looks maybe like it's broken down. And so that's why that's why I'm like,
We should jump on it.
exactly.
So then a common concern about biopsy is that it would, well, you're saying it's not encapsulated. You're saying that there's
Yeah,
no,
and
there's
then
no
the
harm.
other thing about even if it did work like that. So okay, if let's say you had like a neck mass and then you like.
Which I do. I mean, I've got this here.
Oh, okay,
but-
yeah, actually.
And they
Sure
didn't
did.
yet CAT scan that.
Oh yeah. How long have you had this?
We discovered it maybe a month and a half ago. A month.
Okay, so
As we were winding up dealing with the sinusitis,
sure.
then my GP noticed that.
Yeah. So the tissue plane violation or like spreading it with the biopsy,
Yeah.
it has been described. It's usually when you go through tissue planes. So if I were to like make an incision over that neck mass and then take out a biopsy and then close up the neck mass, then in theory you could like track that through there.
Right.
The difference is in the nasal cavity biopsy, it's actually like we're just going through air. Like the thing's growing into space in the nasal cavity side, so we're actually not able to contaminate. You
Because it's already exposed, is basically what you're saying?
Right, exactly. We're not going through tissue planes, we're going through space. The alternative, the flip side is you can say, well, maybe we could just biopsy this with a needle biopsy. Needle biopsies haven't been shown to spread disease because it's just such a small, fine tract. But it's maybe easier to go through the nose.
Do you think they're two different things, or?
I don't think so. Maybe it's worth investigating. I mean, I think my thought is get MRI, at least do nasal cavity biopsy, and present you to a tumor board, our tumor board here. That's what they say. But depending on what the biopsy shows, that we may need to get like a PET CT also to look for anything anywhere else beyond the neck. I mean, we should probably get an MRI of your orbits and neck to evaluate the neck mass at the same time.
Okay.
And then some sort of distant imaging, looking at your lungs or liver.
Okay. Well, you think about biopsy? It seems.
Well, yeah, I mean, it makes sense
Makes
for the
sense.
size.
So, would you be able to perform biopsy today?
Sure.
Yeah.
I think so. Let me then. So, let me just warn you. So, we're gonna start incurring costs, right? Like
Yeah.
right now, we basically haven't done much anything.
Right.
We've just sort of talked, and I will just tell you, and I don't know much about how this goes, but there are all these numbers here. So, biopsy has 435 next to this. It's gonna start skyrocketing really quick, and I have no idea how much like a PET CT costs. I'm guessing it's like
Yeah.
10 times that.
Right. But
Um,
at least we can get some information.
Yeah.
With now sooner.
Yeah.
With
Yeah.
the least amount, and that tells us something.
I'm trying to think about how to get you like hooked up with some sort of insurance, you know?
So I've got to finish the Medi-Cal
Okay.
thing,
Okay.
and let me do that.
Okay. Okay. All right. Well,
And they
then
said I'm going to keep receipts, and they might be able to.
Okay. You got some spray. Let me just look in there first before
Okay.
I promise you can do a biopsy safely here.